GI docs.
What is their stereotype? I feel like I can't really like picture.
I feel like they're quiet, but they're also a good time.
I feel like they're secretly freaky.
Oh, 100. They're literally looking in people's assholes all day.
Grab a coffee, take a breath. You've just clocked into the ER edit.
I'm Caitlin.
I'm Carly.
You are now clocked in. We are back.
Welcome to episode 5.
This one I am so freaking excited for, honestly.
I'm so excited.
Carly sent me the thread of what we're going to be reading, and I read the first two. I'm ready. She is
hilarious.
Sacked. She is
Get ready to laugh.
I know. But this is also not an ad, but have you had the Neuro Mints? Did you know that they had a mint?
Me and my husband are obsessed with the Neuro gum.
Courtesy of me.
You. I was like, Neuro.
What's the answer?
Yeah.
No. If you guys, this is truly not an ad. If you guys are a nurse or work in healthcare, this is your way to go. My husband's obsessed. Your husband's obsessed. You are now obsessed.
I like have to have it with me all the time.
I know. But it's also just caffeine and L-theanine.
Love it.
What more could you ask for?
Anyways, let's get into it. These are going to be hilarious, so get ready to laugh.
We're taking it back to our OG TikTok days where we are reading threads that we found on TikTok. And Carly found this one. Yeah. And I'll let you let her rip.
Okay, so this thread it's somebody posted a question.
Okay.
And then everybody like responds to it.
Yeah.
So the question says, healthcare workers, what's your favorite response you've ever gotten from an MD?
I just love this so much.
Good, bad, ugly, all of it.
I love it.
Had a Jehovah's Witness patient with a hemoglobin of 3.
Okay, we're dying.
And the family said they think she just needed to rest.
Oh.
And when I told the doc, he said, yeah, in peace.
Stop. A hemoglobin of 3 is real low. I mean, like, we want to see your hemoglobin between, like, what, 10 and 13?
We
would
usually
be ideal.
transfuse a blood transfusion if it's less than 8.
Yeah.
Jehovah's Witnesses, usually for religious purposes, though, they don't want blood transfusions.
Although I have had one Jehovah's Witness in my entire career that needed blood, hemoglobin similar. I think it was 4 or 5, active GI bleed. He had all of his family leave the room, bring all of us back in and say, I will take it, but they cannot be in here and they can never know. Mm-hmm. And I said, I got you, boo. I got you. And so does Jesus.
He said, this is not how I go down.
This is not it. I'll take the blood.
Yeah.
Okay. Oh my gosh. This says, as a patient was leaving the cardiologist's office, he said, okay, see you, doc, in a year. The doc replied, maybe in a casket if you don't lose weight. I just sat there like this, and it's the wide eye emoji. I mean, if you're not getting through to your patient any other way, I guess you just got to say it the way it is.
Honestly,
You know what
I do appreciate sometimes just like the down and dirty, like.
I mean, sometimes I think they just
cut
need to
through. Like sometimes you just need to hear that to go, oh.
That hurt a little.
Yeah.
Like that hurt my feelings. Maybe I'll change now.
Honestly, I think we need a little more of that
I agree.
in today's healthcare. Like
Because
we're so worried about how people feel. It's like, no, you need to lose weight, period. End of story.
Yeah, but you know how some people are working sometimes and they say things and you're like, ooh.
Bedside manner.
Ashley, I'm talking to you.
Ashley, my girl.
But also she's who I want in a room with that.
Oh, yeah. Oh my gosh.
It's the laughing before we read it that just gets me.
My patient said, I'm going to die if I don't get out of this place soon. And the MD said, I feel the same way every day at 2 p.m.
I mean, the honesty, right? I love it.
Oh.
Okay. Oh my gosh. Patient was 101 with dementia. You know, those are fighting words. Those 101-year-olds are strong as hell. And if they have dementia associated with it, they're like he or she, man.
Yeah, they'll take you down.
With most of the time poop under their nails.
All 85 pounds of them.
Yes. Patient was 101 with dementia and sleeping when he went from AFib to VTAC to SVT. The rhythm was wild. I called the doc and told him, I think he's going to Jesus. The doc said, I hope so. He bit me earlier. Also, all of those rhythms, just to explain, you need to do something about.
Yeah.
You know?
That's a lot happening.
That's a lot happening with one little 101-year-old.
The patient wasn't happy with their care, so I called the MD to tell them. I called the MD to tell them that the patient wanted to talk to someone higher than them, and the MD said, "Tell them God is busy." That's such a doctor thing to say.
Also, the balls that some of these people have to say some of this shit.
I know, but then the nurse is like, "Okay, but really, what do I do?
What do
I actually say?"
Oh, I hate this one so much, and I have a story to go along with it.
Is it triggering? Am I going to be triggered?
Well, you will hate it.
Okay.
100%. Patient's husband asked for an extra stitch, and the doc said,
No.
"How small do you need it, buddy?"
Are we talking about after birth?
Uh-huh. Could you imagine? Okay, let me tell you a story about this. I know. I knew it would trigger
Everything
you.
about that.
I know.
Everything.
I knew it immediately.
The doctor, how small do you need it, buddy?
Also, this is not a boys' club. This is my vagina. Like, what? I would have kicked everybody out of the room and asked for a new doctor if it was me. But let me tell you this.
I had some
Indy.
nasty comebacks that I'm not going to say.
I wish you would. I had just had Indy. The doctor, Dr. Cragen, may he rest in peace,
R.I.P.
was the most phenomenal OBGYN ever. He delivered all my friends. He delivered me, all of this stuff. Great. We had heard, rumors around the block had heard that he was like basically the vagina's best plastic surgeon, right? Like you couldn't
But he
get
was an
better
OB.
than him. He was an OB. So he was delivering, he was like doing, is that an OB? Yeah.
Yeah.
Yeah. So he was.
Oh, but he just packaged it up with care.
Yes, like very diligent about
Love
what he
that.
did. Not for the husband, not anything. Just like
no.
let's get your shit back where it started,
Yeah,
kind of a thing,
love
right?
that.
Okay,
Thank you.
So I had my best friend in the room with me when I delivered, Margie. Carly knows her. Everybody's friends around here. I deliver. I'm holding Indy. Everybody's doing great. All of this stuff. Cragen is suturing me up. Just had a small little tear there. He's suturing me up. Margie wheels this fucking rolly chair up next to him, as she does. And if you guys knew Margie, this is like so on point for her. She rolls straight up next to him. So they're now both looking at my hoo-ha over here. And she was like, so rumor on the street is that you are literally the plastic surgeon for vaginas that everybody wants. He proceeded to take all of the stitches out that he had already done. And was like, well, if that's the rumor, like, I really need to make sure that this is perfect. So he stitched me twice.
Took your stitches out?
He took them out and was like, this isn't perfect enough, and re-sutured them. So now every time I'm like, fucking Margie made me get sutured twice. But she's like,
But
yeah,
he did a phenomenal job.
Yep. So I guess I should thank her. But,
I love that.
you know, you need friends like that instead of this dick husband that's asking to be sutured smaller.
Well, and then doctor. I mean, that poor wife.
I know. That would
I hate everything.
leave now. Leave now.
A lot of these are like funny, and I thought there was going to be a lot more mean ones, to be honest.
Well, we could tell mean stories.
Oh, we sure could.
I love a good funny one, though. These doctors, I would like to work with some of them.
Everything about this screams ER doctor.
Okay, I can't wait.
Sent a weird looking EKG, and the doc said, yeah, I kind of hate that. Let me go find an adult to tell.
You know,
That's an
yes.
ER doctor. Like, I don't know
literally
what the
have
hell
at
that
least
is.
3 that I can think of right now that would say that.
Yes.
But also, I feel that way sometimes,
Oh, when
too.
you look at the EKGs?
Yeah, I'm like, this looks bad. I'm not sure why. It looks really bad. Who knows more than me right now? That
Luckily,
I can go
we
to?
don't have to, it's not our job to like know. Like, we need to know, but like not.
No, like
We need to give it to them.
yeah, but I'm like,
Something's
do
wrong.
I call a STEMI from triage right now, or do I like, because this looks real rough,
Real bad.
real rough. Doctor tried to put. I can't even read it. I just can't imagine hearing somebody say this. That's like a physician. Doctor tried to put on a medium-sized glove and said, "This is a little tight, snugglicious." Just like right before a code. Could you imagine that being said? I kind of love it.
Patient had a high PHQ-9 score, a depression score.
I was like,
I
what is
texted
that?
MD for a psych consult. He responded, that's lower than mine, LOL.
Oh, shit. Let him go. No 5150
Who
here.
would be a psych doctor? I have one story, which I've shared before, about how a doctor threatened to get my license taken away. Remember that story? I was a new
No.
nurse. I was working med tele.
Yes.
I made a mistake.
Yes.
I will own that. I will absolutely own that I did something that in hindsight, I probably should have handled differently.
Right, but we all have.
But I was advocating for the patient.
Correct.
I'll give you the Cliff Notes version. So I was a new nurse. I was working on a tele floor. I had a patient who had like, I don't even know what they had. I think they had some sort of infection that they had to go get like an IND in the OR, something like that.
Okay.
Like a very simple, like
IND, maybe IR, something simple.
something simple, which is just like draining a wound, essentially. Nothing emergent, nothing like life-saving. They were admitted for IV antibiotics. And so the patient had been there, what I'm trying to get at, for a while.
Sure.
And surgery, they didn't really like know when it was going to be. It was paper charting. And so the chart normally is outside of the door.
Yeah.
But if physical therapy comes, if anyone comes and grabs it to utilize the chart, it's not always right there. So charting doesn't always happen in real time, like charting when you handwrite.
No.
So long story
Sometimes
short,
it happens at the very end of the shift. Like you're keeping all of this as mental notes until the end.
Yes. So I had this patient all day long, like 7 a.m. all day long, supposed to be going to surgery, They had been NPO, which means nothing by mouth, since midnight the night before.
Yeah.
This was the type of patient also who not usually like compliant with like medications, didn't want to be there, wasn't super sick, but if had decided to leave AMA, could have gotten very sick.
Would have been
like
a problem.
septic.
Yeah.
So I was also trying to like keep them there because they needed care. All they cared about was getting food. I didn't get breakfast, agitated. Psych component.
I mean, I feel that deep in my core.
Sure. And I do too.
I love a meal.
So I kept saying, here's the deal.
Yeah.
I can't make you do anything.
Nope.
But just so you know, if you eat something,
we have to start all
as
over.
soon as they're ready for surgery, they are not going to take you and we're
Right.
starting all over again.
Which means you're not eating all over again.
So I was being honest and they were like, okay, I'll wait. So come around like the afternoon, like 3 or something, still nothing.
Ugh.
So they're like now very worked up.
Yeah.
So I page to ask like, hey, do we have an ETA? This patient's really upset. They want to eat. And the answer I got was, we're probably going to take them later today. Don't let them eat anything.
Thank you for your help.
I said, okay. I said, just so you know, they're agitated. I'll try my best. So this goes on. Finally, around like 6 p.m., they're like, angry. They're like, I want to leave AMA, F this place, F you. And I had explained everything to them. And they're like, I don't care. Just give me food. I'm going to eat. They can do surgery a different day. And I said, well, will you stay for your antibiotics? Yes, I will. Okay. So I bring them a meal tray. They eat dinner.
Yeah. Their choice.
The surgeon comes up.
Oh, God.
And
only hear
and
it.
walks in and he sees the patient eating and he comes out and he's like, who fed this patient? And I said, I did. I'm the one that called you. And I went through the whole thing with him. And he was so angry. He immediately goes to the like charge nurse. He comes back and he says, I want your first and last name. I'm reporting you to the board to revoke your nursing license. And I'm freaking out because this is my first
Well, you
job.
don't know any different.
So
You don't know that this literally would have no merit against your license at this point.
He looks at me and he goes, so where's your note about this all day? And I said, I haven't had a chance to write all my noting out. The chart hasn't been in the patient's room. And he goes, oh, so right now it's your word against mine.
What a fucking dick.
So that was also a learning. Like I should have probably in hindsight, like continued to page and advocate before just like giving in. But I still kind of stand by like what I did.
I would too, 100%. Because at the end of the day, we do not have control over these patients. We don't.
Right. And
We can
I
do the
gave
best
him
that we can.
options. I told him all the information he needed to know. I mean, I could have worked a little harder, I guess. But at that time, I really thought my license was going to get taken away.
Well, absolutely. A grown-ass man that's been doing this a lot longer than you points his finger in your face and tells you what he's going to do. You believe it.
So the next couple years I was there, every time I
Was
like
he there?
brush, whatever with him, it was really uncomfortable.
Imagine if you would have ever needed surgery at that hospital.
Oof.
And he was your general surgeon.
Oof, oof, oof,
Could you imagine?
No.
That's what I'm saying. Some of these, like, these ones are hilarious.
These are
Thank
funny.
God.
I love these.
But there are stories, too, that I'm sure we can find a thread for.
Well, and I think that like just even reading these, we can kind of tell, don't you think? Like we can have a good guess at what kind of doctors these are. Like the ER
Oh,
doctor,
yes.
if it's a surgeon,
Oh, yeah.
if it's psych.
If it's L&D, yeah, you know who these are.
I think the longer you work in it and you kind of page different consults, you kind of like know what you're going to get.
They very much have very specific personalities, don't you think?
For the most part, I would agree.
Like ER physicians are the rodeo physicians. Like we're all here for a good time. If you ever party with an ER physician, you are getting fucked up. Don't you think?
I mean, that is an accurate stereotype.
It is. Nick went to one of our holiday parties one year.
The ER.
Yeah, you were there.
No, I never went.
Why do I feel like you were in that photo lineup? It's a hazy day. I literally, listen, we stayed at a local hotel nearby and did like a little staycation. Also, I knew that we were going to have to walk home. I'm just going to call it what it is, right? So we were able to walk across the street from the venue. Mm-hmm. Tell me why I have no idea where my shoes went that night. I left with no shoes and never found them again. But Nick afterwards was like, I can't fathom that all of you collectively as a group can get together and save lives.
My husband has had a similar experience where he was like, this is the group of people
saving your life.
And it's not like a demeaning thing. I think what it is when you get these people out into the wild together
this is our time to
decompress and just like we've all trauma bonded for years.
Yes, and now it's all coming out.
And now you're in a social setting and it just goes.
Yeah, Nick was like, I don't know if I should be concerned or really proud. I was like, well, probably a little bit of both, you know? But that's like the typical ER.
Oh, yeah.
The worst ones to me, I have two.
Doctors?
Yes. Two specific ones.
Let me guess.
Okay.
Neurosurgery.
Number one. Hands down, number one rudest stereotype, I would say.
I've run into very kind neurosurgeons.
Yes.
But I would say that's not the norm.
No. That's why I want to meet Lady Spine Doc so bad in real life because she seems so fucking cool and down to earth that I'm like, why can't I have you to work with? I want to work with you.
Well, I think part of the problem is they're so intelligent.
Yes.
They have to be.
Yes.
And they're so talented.
And you have to be on your game every second
all the time
of the day.
And imagine like you're literally holding people's like lives in your hands, which I know a lot of them do, but you're so intelligent. You're
just
so
their brain.
You're wired so differently. And then you're dealing with people like us from the ER.
Right.
Just Looney Tunes.
Right.
Like that must be frustrating. That must be really frustrating.
When you say it like that, I mean, it's pretty on brand. No wonder they're so fucking frustrated. They're like, where did I just walk into? This is a psych ward. Yeah. They probably think that. Okay, my number two. Can you guess my number two?
Let me guess. For meanest.
Uh-huh.
Okay, so neurosurgery one. Who do I think is the second meanest for paging?
For paging, for seeing in person, like all of it.
Ortho?
No.
No, not ortho.
They're the bros.
Ortho
is
totally
the bros of the department. They come in with their DeWalt drills.
Even working now in the recovery room, because like you can hear their OR music.
Heavy metal.
Oh, no. Like rap. Like they're like the bros, fun, have a good time.
I like that.
Current day music.
Okay, I'm into that. They're a good time.
Ortho's a good time.
Yeah, when they come to the trauma bay, I've never had an issue. And it's like very down to earth, very like whatever.
Who is it then? I don't know.
Interventional radiology.
Oh.
And here is why.
Yeah.
Here is why. And I will throw them a bone because they are most of the time the last ditch effort in a patient's life, depending on what it is. So they see sick ass patients, but they're also like, they'll put in your dialysis fistulas. They'll put in new like G tubes or things like that.
They do
very
procedures.
Basic things. But also if, for instance, trauma surgery cannot fix an arterial bleed or anything like that, they will call interventional radiology and they will be the ones to go in and fix it. So they're literally the last effort in some of these patients' lives to fix it. And boy, do they know it.
Oh, they do.
I feel like they have the biggest God complex. And like I said, rightfully so, like you do big miraculous things, but don't be a dick.
Yeah, it's like that's the bottom line. Like, don't be rude.
Yeah. They all are. Like there is nothing I hate more than going to IR with an ICU patient.
They're also notorious for when we have to recover their patients, because sometimes we do recover IR patients. They are notorious for just dropping their patients off and the doctors don't put in orders.
What?
Nothing bugs me more. So it's gotten to the point where like I won't let them leave, like if they've brought me a patient, until there's orders in the computer.
So you just have to keep calling them until you get orders. That's got to irritate the hell out of them. And then they're mad at you for calling, even though they didn't put orders in.
Yes. It's so frustrating.
Oh, okay. Then we have L&D.
Angels.
They are
literal angels from heaven above.
Some can be mean.
I have not encountered a mean L&D.
I think that's because ER nurses are pretty dumb when it comes to labor and delivery.
Sure enough.
So I think that they come down and they're like, move out of the way. Nobody needs you guys in this room except for Nick. He can stay.
Nick loves.
Not my Nick, by the way.
No, our big Nick at work. We love him, but he loves a good L&D.
He does.
And then there's Peds. Peds is so kind.
I almost feel bad when they come to the ER and hear the way that we talk. Like I almost feel like I can't say certain things in front of them because their ears are too young.
Yeah. So when they come down to the ER, they're consulting kids, which we don't have a ton of really sick kids that we see, but they'll come down for codes. And even in those like crazy codes, like they're just calm and they're kind and they speak with respect always. And I'm like, you're so nice. Like how do you handle this?
Well, they also get emotional. Like we will actively be coding a child, which is horrific. But it's like we've talked about before. In those moments, you kind of have to pull away and just make it emotionless in order to get through it.
Yeah.
And these poor peds doctors, like you can see their eyes welling up and stuff like that. And I'm like, are you good?
I honestly think that's a gift though. And I think they're a very special breed.
It has to be. But also it reminds me of like, oh my gosh, there was like a sound that was trending for a while on TikTok and it was Arizona Robbins talking. And you know, and it was like this like very like, the kids are so different. You have to treat them in a manner that's like da-da-da-da-da. And the way that she said it, I was like, this is everything that you guys are.
Yeah.
You guys are straight up human angels.
It's true. I do love this stereotype game we're doing. So what else? What other stereotype? The trauma.
Oh.
Trauma's interesting though, because trauma docs are general surgeons who have gone on to then do
a specialty
trauma.
in trauma. Yeah.
But when they're not on trauma, they still operate at work in the hospital as a general surgeon.
They have to do general surgeon rotations, at least at our hospital, which is hilarious because if you ever see our trauma surgeons on the general, like, what's that list? I guess you could say on call for them, they hate it.
Trauma's funny and tricky though, because you can have, and I've worked at multiple ERs as you have with trauma, and it's an array of personalities. There's a whole gamut.
There is. We have a gamut of trauma surgeons. And literally speaking back to our last episode about like things I wish I knew as a new grad, this is something I teach all of our brand new nurses. Is their personalities.
Trauma surgeons.
Yeah, because if you walk in there blind to it, you're getting hosed.
Oh, yes, you are. I've been hosed. I've been hosed.
You sure have.
That is a great
I teach
thing
that
to teach
before I teach them how to run the Belmont. You want to know why? Because if you fuck up in that trauma bay with the wrong personality, you won't recover.
You'll be trembling.
You won't recover. And there's no way that that patient is going to get the best care if you don't know who you're working with during that time and what you can and cannot do. Ours are so, like, our trauma surgeons too are so vastly different that you have to learn their different personalities. They don't fit a mold like ortho or L&D or things like that. Like they're literally so individualized.
And depending who's on, will totally change the whole like vibe and mood of the trauma bay.
Yes.
So you have to know like their different nuances.
What about psych? I feel like they're psych themselves.
I mean, they have to be, right? I don't feel like I have to interact with them a ton. Because
No.
They're not usually like there on site all the time. And if you're like if you're paging them, it's usually non-emergent.
No, but I love when I do get to talk to him. It's
Do
one of
you?
yes. Do you remember we used to have an old one that then left,
yes.
and she looked like Miss Frizzle from the Magic School Bus, and she had the wildest hair, and her scrub pants were always like mid calf with like color. She was just my favorite. But she would talk to you about everything under the sun. If I had an issue, I'd be like, "Can I talk to you about something?" And she'd be like, "Yeah." What do we like? It was therapy on site.
Yeah.
But she was definitely.
I am so curious what they do for their self-care. Wouldn't you be? Because the stuff they're dealing with
I feel
all
like
day,
I should
every day
ask.
is just not good.
It's terrible. And they're literally getting screamed at and
Constantly.
all of the things all the time. Who else do we have? Oh, well, we have like HBS docs.
That's like inpatient.
Yeah.
I don't know why anyone would choose that specialty.
It's because you're miserable.
They're all miserable.
Yep.
Their workload is miserable.
Their workload is the worst in the hospital.
So these are the docs who, when patients get admitted and they get admitted to the hospital, these docs oversee their care while they're admitted. So they just oversee all hospital admissions, and they're always overworked.
Well, and their lists are like sometimes 30, 40, 50 patients deep that they still need to go see.
Yeah.
So sometimes in the ER, we'll have people waiting for admission orders sitting in the ER for like 20 or 30 hours just because they can't get to them.
And then they get to them and admit them.
Right.
And the patients don't have a room, and they stay in the ER for days.
Yes.
And I think people don't also realize this, that when we say we have boarders or people boarding in the ER, they're no longer ER patients. They're not even being seen by ER doctors.
No.
So even though they're in the ER and you have a doctor 20 feet away from you, you're still paging inpatient docs because they're admitted. They're an inpatient
To include the fact that
patient.
if something goes wrong with them, you have to call a rapid response now in the ER, even though that's literally what we do all day, is we rapid response
that probably
people
gets
all day.
HBS there. Oh, wait, who did we forget?
Cardiology.
Oh, oh my gosh, how could we?
They're also,
God complex.
uh-huh.
You know what?
As you know what, you do you.
Honestly, I'm impressed. I'm impressed by all of these people.
Mhm.
But cardiology, they have a big responsibility.
They're also very quiet. Have you noticed that?
They can be, yeah.
They're kind of like mousy and very quiet and like sneak around the telemonitors.
Yeah, they don't really want you to stop them for anything.
No.
I've worked with some very, very nice, very willing to teach cardiologists.
Oh,
I've also had exposure to some of the most
you worked on tele.
horrendous.
Yeah.
I worked on tele, and then I also worked on a step-down cardiac ICU.
Mm-hmm.
So post-open heart, pacemaker, like that was all I saw.
Nope.
And so I was calling cardiology all the time. That was most of my first exposure to calling like mean doctors was on cardiology. So maybe that's why I have a little
I
bit
believe
of
it, honestly.
Yeah.
They're not the nicest, but also,
My uncle's a cardiologist.
oh, is he kind?
He's so kind. And it's so funny because I know him obviously not in a work setting.
Yeah.
And I'm like, this is really hard.
But do you ever wonder, like, do you ever wish that you could go into his hospital setting and ask people, what's he like here?
I do, but he was also like the director or something for a while.
So he was like patient removed a
and
little
he's
bit.
very nice, very, very nice. And I did ask him one time, when nurses page you in the middle of the night, like, how do you respond?
Yeah.
Like, what do you think of that? You know, like, do you get annoyed? Do you ever get mad at them? And he's like, no. And even my aunt said, he's so kind. She's like, I'll get annoyed because his buzzer will be going off all night. And when he calls, he's like got the nicest voice on.
What an angel.
So he said the only thing that bothers him is when we like can text, you know, over like chart chat, or we send them a page, but it's like kind of AIM, you know, where you're chatting. So he says nurses who work night shift will message and it'll be like dinging. And then he gets like, because he was like the director, he would get notified when anyone would get paged. So if they didn't respond right away, it would keep coming through and he'd have to respond. So he'd be like, I'd be woken up in the middle of the night, sometimes for prolonged periods. Finally, a response is made. And then like 40 minutes later, the nurse will text back like, thank you, smiley face. And it like dings again. And so he said, that's annoying because they don't realize that it's like still paging.
Well, that's been in our huddles.
Oh, really?
Like, do not say thank you in a chart chat after the doctor has
Oh.
responded. And
Because
I'm like,
of that reason?
I'm sure now that
Yeah.
you say it, that's what it is. But they've like literally presented this in Huddle.
I mean,
and
it
been
makes
like,
sense.
But at the same time, I was like, okay, rude. I'm just
I
trying to be
know.
like respectful. But now it's probably that they're like, I don't want to open up my phone
especially if they're
again.
not at work on the computer.
Right.
Like, that is annoying. I can understand that.
The last one I can think of too is GI docs.
What is their stereotype? I feel like I can't really like picture.
I feel like they're quiet, but they're also a good time.
I feel like they're secretly freaky.
Oh, 100. They're literally looking in people's assholes all day. Like that
Or
is.
their mouth.
Yeah. I mean, they're going top to bottom all day.
Yeah, I don't know. I don't really have a good grasp on GI.
I like them. We will have to do procedures with them sometimes. Like if it's a really sick ICU patient, we will have to do it because their nurses can't. And I will say one thing. I feel like they always over-medicate their patients.
Yes.
Like they're like, I want this person snowed when we do this, you know? And so I'm like, how much of this med do you want me to pull? Like Versed, like how much? It
Yeah.
makes me like a little nervous at times, but they're like, nah, they'll be good. Just roll with it. And I'm like,
and we have RT there.
oh, everybody's
We have
there. It's a
crash
conscious
cart.
sedation. It's everything. That's great. But
But as soon as they're done and they bounce, you're like, okay, this patient's not waking up for
Sir.
a long time.
and they're literally having the best sleep of their life.
Yeah.
Everything is in a safe, like very safe handled. Like, what's the word I'm looking for?
Environment.
Yes, thank you. A safe environment. But it is like, we don't give that for conscious sedations. You know what I mean? Like, we're literally just sedating them enough to like put the bone back in place and then calling it good.
Yeah.
GI's like, nah, doc.
Yeah.
We're going
We
for
want
the full
them
thing.
out. We want them out.
Which I can appreciate. If something's going up my butt, you better put me the fuck out.
Oh, yeah.
I'm not interested.
As a matter of fact, I would take a breathing tube for that. I don't want any recollection, nothing.
No. There better be zero memories of that. Okay, I'm going to read a few more of these.
If any of our doctors are listening, could you guys be a little more
you pick up the
funny with your
pace?
responses?
Oh my gosh. In the middle of a code, and the patient's colostomy bag exploded during compressions.
Oh,
Attending says 4 milligrams Zofran IV stat. I say, you want me to give him Zofran? He looks right at me with the straightest face and says, I didn't say it was for the patient. And he held his arm out.
oh my gosh. I don't know if this is funny or if this would
God.
irritate the shit out of me.
Okay, I'm ready.
I had a BP of 167/67. And the doctor wrote back
6'7".
with 2 hand emojis, 6'7".
You said it just like I did. He's got kids, is really what it comes down to. It would probably irritate me at work, especially because I hear it all day.
I know. Somebody wrote on there, it takes years of soul crushing to get to this level of dark humor. And you couldn't say it better.
Oh, it's hands down accurate, and I am here for it.
We love this.
Oh my gosh.
Also, why were you paging about 167/67?
We're fine. A frustrated cardiologist came up to the ED counter to write in a chart and said loudly, I just need 12 inches. The snarky charge nurse responded with a straight face. So do I after a day like this. The cardiology turned beet red. It was one of the best days of my career.
Who does that remind you
I
of?
have a few people.
That is so good. Patient was mad at me because he couldn't see his results in his chart. I asked the provider and he said, girl, do I look like IT?
That is one thing. Doctors cannot do IT to save their lives.
No. And honestly, neither can I.
Same. This has been a whole learning experience.
This whole podcast is uploading. Oh man.
Mike, we love you.
We love you, Mike.
Messaged the ICU doc about a critical result of an ICU patient that was holding in the ER. And he responded, oh, that's not giving. What would you do if you got a response like that from a doctor?
I feel like we do have an ICU doctor. I could picture that.
Yeah, that's true.
That's not giving.
That's
Giving
not
what?
giving.
Life? That's not giving life.
Do you want to put an order in for that or
It's
no?
giving, do something.
Oh, these are so good.
I could read these all day.
Same. All right. I can hear little footsteps coming down the hall as we speak. Carly and Ryan are going to do a much needed date night, aren't you?
Yes.
So we're going to get on out of here. Thanks for hanging with us.
Bye, guys. See you next
Bye.
week.